And I have a star with me on set today. Well, before I talk about the star, as we get started, please share this link with someone, call up someone. If you need to send data to someone, like I would always say, please do that right now. Feel free to drop your thoughts, your comments, your questions in the comment section. We'll definitely attend to them appropriately. Yes, we're talking about hypertension and fertility. And yes, back to our star. We have Dr. Kenneth Eguda with us today. Oh, yes.
Hypertension specialist. Yeah.
It's always a pleasure to have you with us, Dr. Ken. For someone watching for the first time, it might interest you to know that Dr. Ken is a consultant gynecologist, one of the best, I must say. He's a minimal access surgeon. As a matter of fact, he's the first African to have started hysteroscopy, gynecological laser hysteroscopy in Nigeria and in West Africa. Wow, so much for one person, right? I'm not yet done.
I think we should stop it there. Let's move on.
Oh yeah. So, but then it's today with a fertility specialist. So it also interests you to know that he's a fertility specialist and IVF specialist as well. So yes, like he said, let's stop there. I would always say one of these days we'll take our time to do your biography so that
You should
they know
check
a
that.
lot.
You should check that on my portfolio website.
Oh, okay. So
I think
yes,
everything
for
is
those of
there.
you that are very curious, please you could do that. But today, Dr. Ken will be telling us about hypertension and fertility. As a matter of fact, I think hypertension is really something that is really disturbing. Statistics shows that just in Nigeria we have about 38.2% of people suffering from hypertension. I mean, that's 50% is no longer far. I mean, and it's possible that this could even increase
Yeah, and
over the years.
that's for those who are documented.
Hmm.
Because from what we see, you see people just straight to the hospital
Hmm.
just for just consultation, and the BPs are on the in the roofs already,
Hmm.
and they've never been diagnosed.
Wow.
They're not on medication,
Hmm.
and they're not on any form of lifestyle modification. They kept on denying it that they're hypertensive, and you just hear that is because I just traveled, it's because I had a poor sleep,
Oh yeah.
and all of that. So you
Hmm.
have a huge proportion of people who are not
People.
documented. So if you put
Hmm.
all that in perspective,
Hmm.
I think
It might just
quite
be
a
up
number.
to fifty
It should be up to
percent.
50, or I
Wow.
know, yeah, it should be close to
So
50.
it's more like saying almost 50% are not so healthy already in the population.
Yeah.
Okay, well, so yeah, well, for someone that also might not know what hypertension is, please kindly tell us what hypertension is, so they also can relate when we say hypertension.
Anytime you ask me to tell what this is, or define
It
this, it
takes
gives
you to the
me
four walls of a classroom.
exactly, because then you want to go for an exam. Hey, define this. What is this? What is
Oh
this? I've been
yeah,
out of that sphere
5 marks,
for a very long time.
2 marks.
Yeah, but then for the sake of this talk,
Yeah.
hypertension just means a raised blood pressure,
Mm,
elevated blood pressure beyond what is normal for
mm,
either the population
mm.
or for that individual. Now, the average population has 120 over 70 or over 80 millimeters of mercury to
Okay.
be the range where you have a high blood pressure
Okay.
as normal.
Mm,
Okay. And then when it gets to the ranges of like 140
mm,
over 90,
mm,
already the blood pressure is raised in both arms.
mm,
At that point, you begin to define the individual or categorize the individual as being hypertensive,
mm. Well,
and so that's just it. But there are some categories of people who operate at the blood pressure level lower than what is normal for the population.
mm,
What is normal for the population. Their normal blood pressure may just be 100 over 70 or
mm,
110 over 70.
mm.
So when these categories of people have their BP, raise even to the level that is not classified as
That's the other.
hypertension for the population,
Mm,
and then coming down with symptoms suggestive of hypertension, they can also be classified as being hypertensive
mm,
when they've not met the required measurement for
Mm.
hypertension. Okay,
Okay.
so
Mm.
it could be very tricky for some
Mm.
people because it gets some people with the blood pressure of 130 over 80, for instance, and they're showing frank symptoms or
So
frank signs of hypertension.
hypertension. Wow.
So it's when the blood pressure is higher than what is normal for the individual in this case, you could
Mm.
also be dealing with hypertension. So in
Hypertension.
any case, it is raised blood pressure,
Mm.
that tension.
So, dear viewers, what we popularly call high BP. I think that's the regular way they call it. They say I have high BP. So yeah, so well when you hear hypertension, just know we're referring to high BP, like what you're used to hearing. And so maybe now we should talk about possible things that could actually cause hypertension or things that could predispose people. Are there risk that makes them predisposed to hypertension, or what are the possible causes of hypertension?
Now, when you get to talking about hypertension, for
Mm.
instance, you know, if this is still very correct, when I was in the medical school,
Yeah.
you know, or yeah, we had what we call the essential hypertension,
Okay.
where you have 95% of people having
Mm.
the 90%, 95% of people having elevated blood pressure are
Okay.
the essential hypertension,
Mm.
which means hypertension as a result of aging or
Mm.
aging
Oh.
related conditions.
Okay.
That's to say, a good number of people are actually going to be hypertensive,
Mm.
eventually in life,
Wow.
because it has to do with aging process.
Yeah.
So in these categories of people, yeah, it's age related,
Mm.
and then backed up with some other lifestyle that became or becoming additive to that, like lifestyle of poor eating and
Mm.
consumption of substances
Wow.
that may worsen or predispose them to having this raised blood pressure.
Yeah.
So 95% of people will be having the essential hypertension. That is, they will get there without you seeing any frank cause, but because
Okay.
of aging. And in modern times, with what we know about science and
Mm.
about human life,
Mm.
stress has a resemblance to aging. Stress and aging have a lot in similarity. I mean, similarities.
Oh wow.
So someone can be having so much stress without even
Mm.
advancing in age, but the
Yeah.
body rests stress like
That's
aging
aging.
process, and that is why I see people who are doing so much, not having
Mm. Yeah.
time for rest, just walk and walk and walk, fatigue and fatigue and fatigue. They age quickly, and
Yes,
then they
that's
have
true.
age related disease conditions,
Mm.
as if they are chronologically aging.
Aging.
So
That's
stress
true. Wow.
also put people in this condition. In
That
addition to
makes a lot
aging,
of
stress
sense.
does all of that for them. So
Mm.
that's one common cause.
Okay.
Essential,
Mm.
well known cause, aging and
Mm.
stress.
Yeah.
Then for the remaining 5% of people, there are conditions that could predispose them to having hypertension. Usually, this is the
Okay.
bad kind of hypertension,
Mm.
where you have hypertension in very young people.
Mm.
They may be kids,
Hmm. Wow.
they are kids, teenagers, or young adults.
Mm.
When you have kidney problems, then you are predisposed to having hypertension. You have problem with your adrenal glands.
Okay. Mm.
These are glands that produce stress related hormones that help the
Mm.
body to cope with stress and all of that.
Yeah.
You may have problems with that, then you have hypertension at any age,
Wow.
even as a child.
Hmm.
Then you have heart problems, even as a child, you could have hypertension.
Wow.
So a good number of people, few, I mean, the 5% of people fall in this category. In
Category.
which case, when you
Hmm.
treat these abnormalities, this hypertension would go.
Hmm.
But the essential categories, it just is a lifestyle. You have to
They have to
modify the
live into
lifestyle,
it. Wow.
and that may involve taking medication for
Hmm.
a very long time.
Period of time.
I just
Wow.
don't want to say forever,
Ever.
you know, because you see, the changes that bring about the hypertension has to do with aging blood vessels,
Hmm.
where you have deposition of fat substances or in the blood vessels, tearing of the inside, the inner part of the blood vessels,
Yeah.
and then the blood vessel lacks capacity to expand and relax
Hmm.
easily, so it takes a lot of pressure,
Yeah.
and then and the heart struggles to cope with it. You have all these changes happening as you're aging and eating wrongly at the same time.
Yeah.
So those ones you just manage them and take medications,
Medications for them.
yeah, for a very long time.
So in this part of the world, a lot of people even know they're hypertensive, but then after some time they stop their drugs, and then or when you say, okay, your blood pressure is high, I reject it in Jesus' name. That's like the regular. That's the regular.
That's one way where Jesus
Okay.
Christ suffers a lot.
So that's a regular comment that you get from people, or they maybe, for instance, the doctor prescribes medication for them for 1 month, so you take the medications for a month and then we'll see you. Then they just believe that after that 1 month the hypertension is cured, and
Yeah,
they just
you see, it's that's the brick because people don't understand what this hypertension is all about. They think it's like malaria, you know, or like enteric fever, or some
yes.
some form of parasitic infection
Mm,
that you give antimicrobial and then you just kill it from the system. But if you understand that aging is an irreversible thing for now,
mm,
aging is irreversible and aging is progressive.
yes.
You understand what essential hypertension is.
Is
It doesn't get
exactly.
reversed. You understand?
So
Because you
they
keep
need to know
aging.
that.
And so because you keep aging, this condition it stays with you. And then when you get to a point that you have a regimen of medication that
Mm,
keeps it on a level that is
yeah.
safe for you,
Yeah.
you are expected to continue
Mm.
with that regimen of medication and never get deceived that you are okay now. And so because of that, you want to stop the
Stop
medication. Because when you
medications.
stop,
Mm.
the body reverses itself and get back to hypertension. And then the complication you have at that point is even going to be worse than the person
Worse.
who was never on the
Yeah,
medication.
because I was actually going to get to this point of completion, because a lot of people stop and then they feel like they are okay. So maybe you should let them know what the possible complications that could result to untreated
And
hypertension.
then you want to understand,
Mm,
because most times when I see them in my clinic, for
mm.
instance, yeah, they probably are coming for maybe a gynecological related case, and then
Case.
when I found
Mm.
out they're hypertensive, and then the talk we have to do because of hypertension
Oh my
becomes even
goodness.
more than
Than the
the condition that brought them to the hospital. Because
oh my
one, you
goodness.
want them to start this medication to
Medications.
commence the lifestyle changes, and they
Mm.
keep denying it.
Mm.
One very I don't want to use the word that's very annoying now, but one very common statement they make is that
Make.
I don't want to start this medication because when I start it,
No
I
stop.
can't stop it.
Mm.
And I'll say, okay, so what happens to your BP? And BP progresses anyway.
Yeah.
So people have to disabuse their minds
Mm.
from commencement of antihypertensive medication because you're going to have complications if you
True.
don't start
True.
these medications.
True.
And that's the scenario where you have people go to bed, for instance, and they
They
don't
don't
wake
wake
up
up.
because the
Hmm.
heart has probably failed while they are
Hmm.
sleeping, or they have
Yeah.
thrown an embolus while they are
Hmm.
sleeping and it has
Wow.
blocked a major blood
Oh
vessel
my
somewhere,
goodness. Hmm.
or they wake up with half part of the body not functioning.
Functioning.
It means they
Wow.
have stroked
Hmm.
because the pressure is so much that it has busted some blood vessels in some very
Wow.
vital parts of the body, maybe in the
Hmm.
brain.
Hmm.
And sometimes they may even require neurosurgery
Hmm.
to
Wow.
evacuate
It's that
the
bad.
clots
Hmm.
of blood that may have compressed on part of the brain. Those are
Wow.
complications. So
Hmm.
when they don't start this medication, they run into complications.
Complications.
You
Wow.
understand?
Hmm.
And then it's lack of education. So
Hmm.
I feel those who are cardiologists or primary health care providers should take
Yeah.
time to tell the population about what hypertension really is. Yeah, they reject it a lot. It's not my
Hmm.
portion. So whose portion is it? So long as you're aging
Oh
and
yeah.
then your blood pressure is right, it's your portion.
And
It
then
is yours, and you have to control it.
you have this category of people that they know they have a family history and they're always scared of checking their blood pressure
Ah, yeah. The
because
denial, they're in
oh my
denial.
goodness. And they just like,
You
okay,
know,
I don't want to check, or they'll tell you, I'm sure if you check, it's going to be high. But then if it's high, it's not good. They identify it and then
exactly,
treat
and
you. Why
treat
run
it
away from
because you could
from?
have hypertension and treat and live for a very long time.
Mm,
Very long time.
wow.
What people don't understand is that the human body
Yes.
deteriorates.
Hmm.
Just like the eyes deteriorate, when you're
Yeah.
younger, you can read even in the dark.
Hmm.
You
Children.
understand? But
Yeah.
now when you're getting older,
Hmm.
sometimes you see people reading with extra light.
Light.
That's the
Oh
eye
my god.
deteriorating. You
Yes.
understand? And then the same way the eyes deteriorate is the way the heart deteriorates. It's the
Deteriorates.
same way the
Wow.
blood vessels deteriorate. It's the same
Deteriorates.
way the muscles deteriorate.
Mm.
And that's aging, and that's how death comes closer.
Mm.
You understand?
A very
So
hard
you just
truth.
have to manage it.
Hmm.
If the eyes don't see very well, you give them some glasses to
Exactly.
see. And
Mm.
if they have other abnormality, you fix the abnormalities.
True.
That's just the way it is. The hair
Mm.
gets gray, the muscles become weak, the
Mm.
breast sags,
Mm.
abdomen becomes,
Flabby.
flabby.
Mm.
Then if you have six packs before, like
Three
I see some
packs.
footballers that we know that used to be hunks,
Very mature.
some of them have 8 to 10 packs
Mm.
when they were playing football, and we're following them. And
Yeah.
now you watch them, they just stop football for
Just
for 2 3 years, and they have
six packs
situ,
is now like two packs.
man, they have no packs, they have
Oh
sagging
god.
abdomen.
Oh wow.
So the body deteriorates.
Yeah.
It deteriorates.
Mm.
And so that's the way the blood pressure also deteriorates.
Mm.
And a good number of people go on the high side,
Mm.
hypertension. And so you just need to know that it is an aging process for 95% of people. And then you need to manage it.
Yeah.
And you don't have to deny it. Denying it is like you denying the fact that you're going to age. We haven't
Exactly.
gotten to the point yet where aging can be suspended. Of course, I am a proponent of that.
Mm.
I actually believe age can be suspended because
Mm.
I'm doing a lot of work on aging, and researches on aging. I'm following on that, and I
Mm.
believe that's where the world is
World.
headed.
Mm.
We're going to be forever young, and
Okay.
all of that. But that's not the focus. Of
Right
our
now.
talk. But
Yeah.
blood pressure deteriorates, and
Mm.
people need to just
Know
watch
that.
it. Regular checks, regular checks,
Please.
because blood pressure has killed people in their thousands.
Hi, I can imagine.
Yes,
So you
in
see,
the
dear viewers,
thousands.
high blood pressure is something that the talks cannot just end. But today we're talking about high blood pressure and
Oh,
fertility.
really? I've
So,
forgotten.
so we have to come back to its impacts on fertility,
Mhm.
impacts on fertility for the man, for the woman. Maybe we should start with the men. Most times we're always shooting the women. So let's start with the men.
Yeah, that's true.
Yeah.
For the men, for instance, you see, we look at it in two categories:
Mm.
hypertension without medication
Mm.
and hypertension with
With
medication.
medications. Okay.
So I'm going to try to be as brief as possible so we
Possible.
could cover a lot of grounds.
Mm.
So now, the aspect of a man that contributes to fertility is the sperms.
Okay.
Those tiny things you barely see except with the aid of a microscope.
Mm.
Now, when a man is hypertensive, quite a number of things happen to his sperms.
Okay.
Let's assume he's not even on medication.
Mm.
The count of the sperms are likely going to reduce.
Wow.
Remember, I'm not saying they must reduce. They're likely going to be
Going to
reduced.
reduce.
It affects the morphology of the sperms negatively.
Hmm.
It affects the motility, that's the movement of the sperm negatively, and it
Wow.
reduces the capacity of the sperms to make pregnancy.
Hmm.
It affects the testicles, for instance. The
Wow.
testicles is supplied by end blood vessels. It's
Okay.
like an end organ. So the blood
Hmm.
vessels reaching the testicles are very tiny blood vessels. So
Hmm.
hypertension actually reduces the capacity of blood to reach the testicles, and
Wow.
that reduces the process of sperms production.
Production.
So
Wow.
this is how it affects the reproduction for a man.
Hmm.
When the morphology is reduced, the motility is reduced, the count is reduced, you've
Hmm.
already compromised the chances of achieving pregnancy.
Pregnancy.
And
Hmm.
and a good number of people coming for assisted reproduction technology at that advanced age, that their BP is already beginning to show
Hmm.
some bad behaviors,
Hmm.
and so it may be responsible for why some people actually fail.
Wow.
Yes, it could be responsible, but it's not to say those with hypertension cannot make babies easily. They can,
Hmm.
but a good number of them have this effect. And if the
Hmm.
sperms are not in the best of form, of course, it could affect even the genetic components of the sperms, and that
Sperm.
can
Wow.
affect the health of the baby
Hmm.
conceived and delivered. We
Wow.
need to be
Hmm.
seeing this in all this line so we can understand
Hmm.
how important hypertension is.
Yes.
Then the
Yeah.
other arm is for those who are hypertensive on medication.
Hmm.
Now, in our facility, for instance, we take time to look at all the conditions that surrounds an individual:
Yeah.
health, medication, diet, and physical lifestyle.
Yes.
To be able to address your fertility concerns or challenges.
Hmm.
Now, a good number of the medications may not be safe if you're thinking of conception. If you
Hmm.
have problems with conception and you're
Conception.
thinking conception,
Hmm.
you may need to have a dialogue with the cardiologist or with
Okay.
the physician
Hmm.
to edit the medications.
Hmm.
So you
Wow.
could have medications that are healthy. For instance, diuretics,
Hmm.
which is very good for Africans, you know, uh, has a lot of negative effects on the
Wow.
sperms. You
Wow.
understand?
Hmm.
It affects the quality, the morphology, the motility, and even the content,
Hmm.
the liquid content of the sperms.
Wow.
And
Hmm.
so that reduces the quality. So
Sperm.
what we do in our setting is we look at all the medication. That is why you
Okay.
see when you say in medical school you do history taking.
Hmm.
Are you hypertensive? Are you on medication? What medications
Are
do you
you
consume?
on
Can we see the names of the medication? So
medication?
we run a check on all the medications. The ones that are not okay, we advise them to have a dialogue with the cardiologist
Hmm.
to have them change.
Hmm.
Yes, to the ones that are befitting for pregnancy
Hmm.
for the man. you
Yes.
know so if you don't have good enough medications, we just try to change the one that you can use when you finish your fertility care treatment. You could
Yes.
revert
Back
to
to
those ones that still
yes.
damage the sperm, because you have to balance your health. We
Yes.
need the
True.
BP to be fine, but at some point we need the sperms to be fine.
Hmm.
So we need
It's
to
true.
balance it. So that's how it affects it.
Hmm.
And
Wow.
if we're dealing with assisted reproduction, for instance, um we want the gamete to be as normal as possible,
Possible.
close to
Hmm.
what nature provides,
Hmm.
so we can achieve good results. So
Results.
that's
Wow.
how it affects the
The,
reproduction for men.
for
And I
men.
take the matter of the drugs seriously.
Hmm.
So if they have no cardiologist hygiene, yeah, because we're all doctors, we have training to an extent
Medical
in medical conditions,
conditions.
hypertension,
Hmm.
diabetes, and all of that.
All of that.
Even though we are aware there are people whose specialty is
Yes.
that. So if they are
Yes.
dealing with their specialties, we do a shared care.
Hmm.
Hey, go back to your specialist. This
Yes.
is what we are asking. It's for
Okay,
your own good.
review. Hmm.
Yeah.
Okay, so you see that we've he has talked a lot about the impact of fertility on the man. Like it's really eye opening. You can imagine some things that people overlook. So yes, if you're a man and you know you're likely to be hypertensive, you don't think all is well. Please check yourself and be very sure that you're okay, and make sure you get good care for the people that have refused to get treatment done. For some of the young people that are already hypertensive, you also have fertility prospect of wanting to have your children for those that want to have. So I know you wouldn't want to jeopardize that by just ignoring hypertension right now. So please treat yourself, and like Dr. Ken has let us know, you could stay healthy for a long period of time as long as you're able to manage your lifestyle well and maintain your medications, and also regular follow-up with your doctor. Because yes, it's another thing. Sometimes you see some of these clients, I think they just, once they know the name of the drug, permanent, they just continue,
They
and then they
continue
don't bother,
buying.
they don't bother to seek help,
Yeah.
to see, okay, maybe a review or a follow-up with their specialist. They just assume everything should be fine. Should they say this drug, let's
We keep
just
taking. Because
continue.
sometimes you be on these drugs and the drugs take the blood pressure below what is expected. So you
Mm,
need a constant review so that your dosage and regimen could be adjusted for your own
adjusted.
health. And
Mm,
then sometimes, other disease conditions that
could be
could be
certain.
related to hypertension could be looked out for. Like the
Mm,
thyroid disease, for instance, can give you elevated blood
blood
pressure.
pressure.
Even diabetes
Mm,
can worsen your blood pressure.
mm,
So all of these will be looked at and then corrected and all of that. So sometimes before you have fertility treatment, you have to treat hypertension, you have to treat diabetes, you
tis
have
and
to
all
treat
that.
thyroid diseases,
Mm,
you have to treat
it's
kidney problems.
and all,
So
it's
you can
just a
just
lot.
optimize. these gametes. Yeah, yeah,
Yeah.
yeah. So
So it's we've had a lot for the men. Now let's get to the women. Women, I know that our matters are never ending as women. So maybe now we should talk about the impact of fertility on the woman.
just the way it affects the man, it
Mm,
affects the woman. And I don't
yeah.
want to look at pregnancy yet
Mm,
because as a resident in gynecologists and or regular obstetricians and gynecologists, you deal
mm,
with hypertension in pregnancy a lot.
I
You
can
know,
imagine.
priming the pre-eclampsia,
Hmm.
PIH,
Wow.
eclampsia, and all of that. Real hypertension affecting babies now. But
Yeah.
now, hypertension affecting fecundity, as ability to conceive,
See.
the
Wow.
rate of conception.
Hmm.
Yes, that's before a woman is pregnant. Hypertension has an effect on it.
Hmm.
You know, it affects the quality of eggs.
Okay.
It affects ovulation.
Wow.
Yet it
Hmm.
affects fertilization for a woman.
Mm-mm.
It also affects implantation when
Wow.
hypertension is not controlled.
Oh my goodness, that's a lot.
So you see, it affects even before conception.
Yeah.
So it's an aspect that nobody seems to have paid so much attention
Attention
to.
to.
And that is why if you go to a preconception clinic, for instance, clinic
Yeah.
of those who are planning to get pregnant, all of these conditions are looked at
Hmm.
and then try to control them before a woman even embarks on pregnancy.
Yeah.
Otherwise, the quality of eggs may be poor,
Poor.
quality of
Wow.
implantation will be poor,
Hmm.
quality of fertilization and embryo development may be affected
Wow.
negatively, and all of that. So
Wow.
these are all the things
Hmm.
we're looking at.
So you see, there's just a lot that the impact of
Mm,
hypertension could have on the woman, and it cannot just be overemphasized. Like I think Dr. Ken has also mentioned about pregnancy, what it could actually cause on pregnancy. Well, maybe before we continue with the management, someone is asking if amlodipine and zcandesatan
mhm.
affect fertility in men. Okay, that's from Aderayo. Aderayo from TikTok. Okay, yes, that question is coming from TikTok.
Yes, of course. You see, this medication, the candesatan, for instance, is an
Okay,
angiotensin receptor blocker or converting enzyme
okay,
blocker.
bro.
This particular drug and the
Mm.
category of the drug affects sperm development.
Wow.
You understand? So it has a negative effect on sperms.
Mm.
It doesn't necessarily mean you will not get pregnant when you're taking it. But
Mm.
of course, if I know it's going to affect you, why do I have to give you this medication? So it's
Mm.
better to avoid it, okay? And then amlodipine, sometimes it reduces the mobility, that's the motility of sperms. But it
Wow.
is better, it's safer than the candesatan. So you
Wow.
look for the one that is safer, has
Mm.
less effect, and
Yes.
then you can tolerate it. But candesatan, for instance, it's not friendly. Some of these medications have not been the researches have not been extended to humans yet,
Mm.
but they've been done and over on
Other
lab rats.
animals. Mm.
The hamsters and what is this other small rats we use in the laboratory.
I'm
I've
not sure
forgotten.
I know.
Yeah, these small white rats, that use in the laboratory. They have the same gene makeup with
Okay.
humans.
Mm.
So most of these medications are tried on them.
Mm.
But if it affects them, why won't it affect humans?
Humans,
Because we are basically the
exactly.
same with them.
Mm.
You know. So,
They're
but the
all
researches are
mammals.
coming gradually on humans because
Mm.
reproduction is getting too molecular, and
Mm.
then we're looking deeply into this. So this is not too good for reproduction
Oh well.
for a man, even
So
for a woman.
okay. So
I mean, the candesatan, for
yeah,
instance.
so Adira, you're well. Thank you for asking that question. Just in case you or someone you know is on this and they are maybe trying
Mm.
fertility, maybe you could just revisit your
Your
cardiologist
cardiologist,
so
yeah.
they are able to review
Hmm.
your medications and
Yeah,
give you what's appropriate
for
in
you.
favor of
Mm.
fertility.
Mm.
Okay, so maybe now we've talked a lot about the impacts. Maybe we should say a little about how they could manage this condition, both with impact on men, women, how they can just manage their lives generally with hypertension.
Yes. So, on part of the woman, it affects the baby's growth. It can make
Mm.
the baby having a restricted growth. It could make the placenta poor.
Oh wow.
Then it could make the water around the baby, which is the amniotic fluid, reduce during
Wow.
pregnancy.
Wow.
It could make the woman have a quick delivery
Hmm.
because of complication, and it could make her lose pregnancy. Then,
Hmm.
if the blood pressure is not managed, I mean, appropriately or quickly,
Yes,
she
yes.
could have preeclampsia and eclampsia, and this is a major cause of maternal mortality,
Wow.
especially in this part of the world. Okay,
World.
so this is how it affects the gross pregnancy.
Pregnancy.
You understand? So you're talking about control.
Yes, how
Yeah,
the man
the
and then
control is
their
to have a
lifestyle.
lifestyle. For instance, if there is a way to reduce stress, I would like to start with that for both parties, the male, the female,
Female.
and children.
Yeah.
Because we do not check hypertension in children, a
Children.
lot of kids, let me say not a lot, in a few
Good
kids,
enough.
go with hypertension, which could be very disastrous for
For
them,
them.
because for them,
They're
the
still
systems are
growing.
young, but they could have a secondary cause of hypertension, like the kidneys, adrenal glands, the heart, and all of that. So
Yeah.
everyone needs to be checking. So I think the pediatricians, for instance, should have a habit of checking the blood pressure of
Of
kids.
kids.
There is no harm if you check and it's normal, but you'll be
Yeah.
surprised at the number that is not normal that we're seeing. After
Hmm.
all, how can you explain a child of 10, 20, 12 years come for an x-ray, for instance, and you
Then
see the heart is
it's
very large?
enlarged. Oh God.
Nobody thinks about all of, oh, okay, not too many doctors think about
Think
all of that,
about
but I
it.
think
Yeah.
it's okay we start doing that. We may save one or two kids. Yeah, so regular BP checks, is one thing. And once BP is peaked for anybody, you should look at the lifestyle, minimize stress, do a lot of physical activities in the form of exercises,
Yeah.
and eat healthy, reduce spice. I think these are just the things that should be done, and do the
Okay.
medication.
Yeah, because the exercise part for me. Because in this generation, we have a lot of people
Mm.
that have this sedentary
Yeah, yeah.
lifestyle,
Mm.
from the car to the office, AC, and then back to their car, back to
Mhm.
their houses.
Just like
They
me.
so
you
they
know, but
barely could
but
actually
but
even walk
but
for
I
up to
do,
10,
I do,
15
I do,
minutes.
I do exercises. I
Mm,
walk a lot during work, for
mm,
instance, and for my house, for instance, since good number of reasons, I may not be going out because there may be no time. So
yeah.
I have my lifestyle, for instance. I have a gym in my sitting room.
Oh
So my
wow,
sitting room
wow.
is a blend of sitting room and a gym.
Gym,
You
wow.
understand? So
That's
I may be sitting, but I'm sitting on a gym device.
oh wow.
So that's just to improve because we're all aging,
Yeah,
and
true.
this hypertension doesn't excuse a medical doctor
Oh yeah.
or a
Yeah.
farmer. We're all facing the
Mm,
same end as humans,
mm,
so my treadmill is beside, my vibrators are around the corner,
mm.
so I save a lot
Just
of
to
time
keep
doing
fit.
that, just improve blood
Keep fit.
circulation, muscle tones, and all of that. And
Yeah.
the day I have the grace to go to the regular gym, then I go to
Yeah.
gym.
So,
So yeah, exercise, lifestyle, diet,
mm. And so
and
yes,
pray to
so
God.
oh yeah. Of course, God over all. But some people dwell on the prayer more than they do the work themselves.
You should do more of the work and less of
so, so
prayers.
so that you don't embody God with things that you could
Of
have actually
course,
done
God
yourself.
won't do exercises for you. You have
Exactly.
to exercise. After all,
Yeah.
why don't you pray to God to teach you how to eat?
You hear some people say, God help me lose weight, and then you are doing late night eatings. You have the
That's
bowls of muscle of maybe 3 wraps around you. And
mhm.
you're saying,
And
oh God, I want to
and
lose
more
weight.
importantly, the refined food, the Western
Mm,
category of food. Our
mm,
traditional African foods quite a lot more healthier, yeah, than the
mm,
Westernized. So diet, but right dieting. I don't
right
know
diet.
nothing about diets, but I know there's something called dieting.
I'm sure the junks are definitely not good.
No, they're
Oh
not.
yeah.
They're not good. Not
So
all the
oh,
time.
oh yeah.
Yeah.
So less junk and less processed food, right?
Yeah.
Right.
Yeah. Yeah.
Okay.
Mhm.
Okay. So I think we have a comment coming from Okolo Ruth. She said she gave birth 3 years ago, and ever since she has been battling with weight gain. And there's nothing she hasn't tried, but nothing is really working. And secondly, she has PCOS. Well, I'm not
Oh,
sure. I
Jesus
think, oh,
Christ.
oh my God. So maybe Dr. K just say something to her, because I'm not sure what
So
exactly.
this is a very sorry about what the conditions are, but they look very
Mm,
complicated. Yeah, weight gain.
yeah.
Naturally without PCO and you give birth, a lot of people just lose it when they give birth.
Yes, yeah.
Taking care of kids can be very
Very,
difficult.
yeah, true.
And that's where I'm still happy. I'm still a guy. But I'll be supportive. I'll be very
Mm,
supportive.
yeah.
You just lose it. you lose your mind, you lose yourself, you lose your activities,
Mm.
and you struggle to get back your
To
your 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 your,
yourself.
your yourself.
Yeah.
So for this person, you can do everything. Treat the PCO, for instance. There are different modalities of PCO treatment
Mm.
that can help minimize the weight gain coming from PCO. Then you
PCO.
have to be very
Mm.
disciplined to do some physical activities and a lot of when you give birth and you're breastfeeding. I don't know, I've not done that before, but I heard they eat a lot.
Well,
You
when you,
breastfeed, so you eat
you
a lot.
well, yes, some do. While some is for them, it might just be genetic or natural that they gain the weight. Well, and there are
Exactly. And
some
then the
that
hormones
just
are just there,
yes,
the water
exactly.
you accumulate during pregnancy. But if you're
Mm.
disciplined, a good number of ladies give birth, and before you know it, they're back,
So
better
fit.
than what they were before even pregnancy.
Mm.
But in any case, you should do all things to get back to your weight, even if you have to do liposuction, for instance.
Mm.
If you want to
Wow.
do liposuction or some weight reduction surgeries and all of that, you should do it because you see, people look at plastic surgeries or cosmetic surgeries as mundane things or as vanity surgeries. But man, the health benefit of cosmetic and plastic surgery is out of this world.
Mm.
Because you see, if you have a liposuction, for instance, or a tummy talk, or whatever talk you're doing, arm reduction, the
Reduction.
thigh reduction. Do you know what you're
Yeah.
doing? You're reducing a load of fats
Mm.
and giving room to your insulin to
Mm.
act effectively. That
Mm.
helps you to control weight. It helps to prevent metabolic disease, prevent
Disorders. Wow.
diabetes, or
Mm.
help to control of diabetes and
Mm.
control of hypertension. People do
Wow.
not know this, or they don't emphasize on this.
On
All they
this.
emphasize is, hey, she's trying to look good,
Mm.
or he's trying to look good. No, it's for men and for women.
Mm.
The health benefit outweighs the cosmetic
The
benefits.
benefits. Wow.
Yeah, a lot of people are about losing their mind and their life because of weight. But just gastric reduction surgery or bypass surgery does a lot of benefits. So if you've done everything you say is not working out, tell you've not done enough yet. There is
Okay.
a surgical aspect to it.
Okay, so Ruth, hope Dr. Ken has been able to address your concerns. Yeah, so sorry about the whole weight gain. We also do not know so much about your history, so we might not be able to give you the full details right now. However, we hope that somehow you're able to shed this weight as you're really hoping to do and work on yourself. I'm sure if you put in most of the things that Dr. Ken has actually mentioned, I'm sure you do a lot better and you do just fine.
I like to be a plastic surgeon, man.
Oh,
I
Ken.
will do a lot of plastic surgery. I'll make
Okay.
sure all my antenatal women have tummy
Oh
talks.
my God.
Tummy
Oh.
talk and weight reduction surgery, because you don't
Mm,
know, it helps ovulation, it improves fertility.
mm.
Those are the positive aspects. You see,
Please
I'm already,
increase the
I'm
volume
already,
of the mic.
I'm already making markets. I need some plastic surgery, guys, man.
Oh yes, so Ruth, and then for PCO, I really do hope that you're also able to get a good fertility specialist that is able to give you proper treatment, so you can, because I believe if that is also taken care of, maybe some of this weight gain could also be controlled. So we hope, well, you could also book an online consultation just in case you're not able to access us physically, and then we could start up from there. And now I have a comment from Ella. She said, what happened or what happens when a woman is not hypertensive, but it happens during pregnancy?
Yeah, this is
Ella from TikTok.
hypertensive diseases in pregnancy. Okay, it
Mm,
could be the pregnancy-induced hypertension, which
mm,
eventually would gravitate or whatever escalate to preeclampsia,
mm.
for God forbid, eclampsia, and
Yeah.
all of that. Some even happen after delivery,
Mm.
postpartum preeclampsia, or even
Wow.
eclampsia, or
Wow.
yes, sometimes this may be genetic,
Mm,
which depends on the kind of implantation, the kind of fertilization, or kind of modality of getting pregnant,
mm.
you know. But then it's okay if it is seen during pregnancy and it's going to be controlled during pregnancy, and she should be cared for by an obstetrician. And usually she should be on medication if it is high enough, the BP would warrant medication. And after delivery, she doesn't just stop the
Stop.
medication,
Mm,
she goes on with her follow-up,
mm.
because and stop the medication if she has to, under the care of
Of.
the obstetrician and the
Mm,
cardiologist. And these
mm.
categories of people actually become hypertensive eventually in life. So this
Later.
is a
Mm.
is a sign that you're likely going to be hypertensive later in
Hypertensive.
life.
Mm.
So a lot of women go through, especially first timers in pregnancies.
Pregnancy.
Yeah.
Okay, so Ella, I hope that answers your question. Yes, it's possible for your blood pressure to return to normal after delivery, but
Mm.
you don't just abruptly stop your medications like Dr. Ken had said. You would have to do that with um, attention from your doctors and be sure that you're good to go.
I don't know why. Let me ask you this question because you're a woman. I think you've asked me over
Okay,
20.
please let me be a man for now.
You've asked me over 20 questions
Okay,
now. Why are
okay.
women always in a rush to stop antihypertensive when especially they just give birth and they are hypertensive during pregnancy? Why?
Well, so this is me just thinking. It's possible they feel since it's pregnancy that resulted to this, I've given birth, the BP should be fine. And then some of them do not understand that it's not just automatic. Hormones are not, they've not worn out of the system. Like it takes time. But it's not easy to keep up with medications. So at some point, they are compelled to take this medication because they know they have a baby inside of them. So once the
Oh,
baby is out,
okay. You're ready
they
to make
feel
the
like the
sacrifice.
baby the
The
baby
baby
is
is
out.
out. So
So
the baby is out.
so now whatever is causing the BP is out. I think I should be
So, so,
fine.
so what I think is
Mm.
this. They hate the word hypertension and they don't like to be associated with it.
So, but I don't think we should relate that to just the woman because everybody hates
Well, I
it.
see women a lot, so I make my judgment from women. They stop it and
Mm,
they thought after. So I think one is that they reject the education because most times I mean, bear witness with the obstetricians that most
mm.
times they tell them not to stop this medication.
Medication, yeah.
When I was very active as an obstetrician, we always tell them, but just come back, madam, you're not on your medication. And she just gives you that look. Am I supposed to continue this
The
medication
medication.
forever? I still ask you to stop it. I thought when I deliver, I should stop it.
So
But that's not
that's
what we
usually the
said,
notion.
and then we now go arguing back and forth, medication, no
Mm-mm.
medication, medication. Before
Yeah.
you know, complication
All
arises.
right.
So women should stop. And maybe and some of them are so religious,
Mm.
so religious. But the body is not religious. The body answers to nature and
Mm.
answers to science.
Yeah.
And they should, to a large extent. I'm not saying science is perfect.
Mm.
It's not. Sometimes science may not science may not capture your own perspective as human nature, but it captures 98% of humanity. So most times you should listen to science than your common sense or
Okay.
religion.
Says the scientist.
Oh, yeah.
Okay. Oh yeah. So I just want to take this pause to say I think I have a lot of engagement coming from TikTok. I love to say, guys on TikTok, we are so proud of you guys, and we're excited to have you guys keep us busy on sets today. So Bebe is asking if House Hospitals is now in Abuja. Okay. Well, maybe I should
You
do you
let it out.
yeah, it's in Abuja, but you definitely be updated once it's fully functional. Okay, and then I have some comments coming. Patients Pada is saying thanks for a successful hysteroscopy procedure and thanks for a wonderful live session. Patients, thank you for that comment. Yes, this is going to help. She said, "You guys are the best at what you do. Keep up with the good work." Oh wow. Bravo to Alps Hospital. Thumbs up to Alps Hospitals. And this is another question on hypertension. Let me know more that this name. However, she's from TikTok or he's from TikTok. Can a woman taking Ramipril 5 milligram and indapamide 1.5 milligram affect conception?
Yes, the ramipril is not healthy for pregnancy.
Mm,
So you should have a discussion with her cardiologist to
mm,
place her on a substitute or an alternative that is healthy for pregnancy.
mm.
These are all the ACE inhibitors. I think, yeah,
Medication. Mm.
medication. Sorry,
Okay.
I'm not hypertensive specialist, but from my knowledge of pharmacology, that's where
Mm.
that drug falls in.
Okay. So Bi- Billiancy, please forgive me. I don't intend to murder the name, but I really hope that answers you. So, just in case you're trying to conceive or
She,
you
she
know
should, yeah,
someone, please have a talk with your fertility specialist and
cardiologist.
your
Yeah,
cardiologist
yeah.
as well, so you're able to be on the same page to achieve conception. So, it's been very, 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 very amazing, exciting, engaging with your
You can't end. No,
devils
not
today.
now.
Oh yeah, I'm not ending. Okay.
Not now.
So I'm not ending up. Okay.
Not now. You
Okay.
see, I'm looking at the world,
Mm.
you know. So I want you to take me very seriously.
Okay, like I've always taken you as a joke.
Take me very
Okay,
seriously.
okay.
Because you see, 95% of hypertension as a
Yeah.
result of aging.
Okay.
You understand?
Mm.
So this is for the future. We're looking at the future where aging will be classified as a disease, and
Mm.
people will have options of living young. You remember that song, Forever Young? I
Yeah,
want to
I wanna
be
be
forever
forever
young,
young.
and all of that.
Yeah.
Yes, it's a song, but I think that song was prophetic.
Mm.
Yeah, it was
So
prophetic.
preach
Let's go
on,
to the church
preach
now,
on.
right? That song is prophetic because I
Mm.
speak with you, a lot is happening.
Mm.
And then you either choose to believe and accept it and move with it, or decide to overlook it, reject it, and reject it, and then you suffer the consequence.
Oh yeah.
You know, aging will be classified as a disease,
Mm.
and then we understand what makes people age, what makes them have hypertension because of aging, and how to stop all of that. So when people access that level of care,
Mm.
aging is going to be just a number, but not having a physical effect
Mm.
on
Yeah, body.
the nature, the body.
Mm.
And that at that time, hypertension,
Mm.
diabetes, cancers that are
Mm.
age related, and a whole lot of diseases that are age related would be taken care of automatically,
Wow.
by that kind of age related genetic treatment.
Mm.
I think that's going to be a very good word. Then we'll
Olu.
stop talking about hypertension. We'll
Mm.
be talking about young forever.
Forever. Okay. So look forward
Then the
to
problem we'll
that
be dealing
time.
with then will be different.
Mm.
Yeah, because your eyes will see for long,
Yeah.
and then you'll be more productive even at your old age.
Mm.
Yeah, because age at that point will just be number. But
Yeah.
now age is not just a number, it's both
So
number
a disease
and
too.
disease.
Yeah.
Age is really a disease, and you better
Mm.
accept it. My mom is advanced in age. I can't tell you. I don't envy her.
Okay. So, okay, yeah. So, on these notes, yeah. So, Doctor Ken, I take you seriously, and I've noted all you said. Okay,
When I offer you
so
the treatment, accept it.
so that point is well noted. I will keep it on the records, and we'll ensure that when it gets that
Oh
time, we
God.
would get. So, this is Justina saying thanks, Ups team, for this life changing topic. And at this point, we love to also say that for as many people out there that battling with hypertension, yeah, we know it's not, yeah, even though now it sounds like a topic and it sounds like some of the things we're saying are laughable, but it's also it's something that is also, should I say, worrisome. Yes.
Mhm.
And we sympathize with as many out there that are actually having these conditions. Yes, you found yourself in there, and like we said, everybody would age until the solution that Dr. Ken and his team has to bring comes up.
Mhm.
However, please do ensure that you have your regular follow up with your doctors, your regular on your medication. Stay healthy, adjust your lifestyle, modify, and really hope that you're able to live long and stay healthy. Thank you so much, dear, session with you guys and with Dr. Ken. I'm sure you also enjoyed me as a host. Thank you
Oh
guys.
well.
Oh, yeah. Oh, yeah. So have a lovely evening till we come your way next time. Bye.